morning, everyone. Okay, so today we have 2 new local community cases and 2 overseas acquired. Now, we're not concerned about the 2 new local community cases because they are students from Sir Thomas More. They're linked to that Sunnybank cluster, but they have been in their home isolation. But Dr Young will go through a little bit more details there, but we consider them at this stage to be low risk. We have 2 from in hotel quarantine from overseas, but can I just give a very clear message to the 1,000 families from Sir Thomas More that are actually doing home quarantine at the moment for 14 days. We are thanking you for doing the right thing for Queensland. We saw how well it worked in the Indooroopilly cluster when everyone did the right thing. Now we're asking every one of those families, because as we're seeing, we are seeing a few cases pop up from that cluster, but they are in their home quarantine. So that's a really big shout out to those families. So please continue to do the right thing because you're helping Queensland. Okay, so we now have in the tests, we had some good testing numbers overnight as well, 14,506 tests. And yesterday, Queensland Health did 15,378 vaccines, which is fantastic. So we now have 56.39% of eligible Queenslanders with their first dose and 38.08% fully vaccinated. And of course, today the vaccination program for 12 to 15-year-olds opens up, which is absolutely wonderful news. And I know that there's a lot of students out there that are looking forward as well to getting their vaccine. So it's a bit of a families are going out and getting it together, which is great to see. In a good record as well, last week Queensland Health did 146,182 vaccines, which is excellent. Boondall, which we opened up, delivered 7,095 in the first week, including 1,500 yesterday. So I want to thank everyone for coming out and getting their vaccines. We were down at Mount Warren Park the other day. They have delivered 894 since Friday, and they did 593 yesterday. And we also had that trial of the pop-up clinic for the NRL at Rocky. We had 129 people who got vaccinated and 492 at their normal vaccination centre. So that's wonderful to hear. I can also announce that we'll do it again in Mackay this weekend. So we've got some footy happening up there, and there'll be pop-up vaccination clinics there as well. And the Health Minister will give more information, but we're also opening a new vaccination centre today in Toowoomba. So as you can see, as we get more supply in from the federal government, we're able to open up more vaccination centres. And once again, can I encourage Queenslanders, now is the time to get your vaccine. Remember I said we've got this really clear window of opportunity at the moment. While we don't have a big Delta spread in Queensland, go and get vaccinated. Every single person who's getting vaccinated is helping out Queensland. The State Disaster Coordinator will give an update about the border bubble, but we're happy with how that's going at the moment as well. So, of course, a lot more people will be able to come into Queensland and vice versa to do their essential work as long as they've had their vaccines, and of course schools can go back there as well. So with those few words, I think I'll hand over to Dr Young. Thanks.
Thank you, Premier. Yes, so 2 new locally acquired cases, and both of those are students at St Thomas More College, and were both in home quarantine. One of them did have a short period of time infectious in the community before they went into quarantine, so there are some additional exposure venues that are up on the website. But I'm fairly confident that that cluster is in hand because of the fantastic work done by the Metro South Hospital and Health Service Public Health Unit, getting all of those children into quarantine, and the response of the school and those 1,000 families. That's been excellent. And as a result of all of that great work, that I'm confident enough that I think we don't need those ongoing restrictions for aged care, disability care, hospitals and prisons, so they'll be able to immediately return to their normal practices. They don't need to have those additional visitor restrictions that were put in place late last week because of that evolving cluster. So that's all working well. Now, we do still have some concerns about the numbers of freight drivers who've been infectious in our community. So there are quite a list of exposure venues that I'd really like anyone who lives in Brisbane or in Logan to really have a look at and make sure that you haven't been to any of those exposure venues at those times. And also, anyone who lives in Brisbane or in Logan, please, if you have any symptoms at all, as this family did, please just come out and get tested as quickly as possible. And we saw a lot of people doing that yesterday, so thank you very much. If we can find people very early on in an outbreak, it means we can immediately respond, as we've done with this most recent cluster, so we don't have to have restrictions continuing going forward. But it's a matter of finding those cases early. Then the other thing we can all do is we're hearing from the Commonwealth that more supply of vaccine is coming into Australia. So it's really important that we avail ourselves of that. So please, anyone 12 years through to 59 years of age, come and get Pfizer or very soon Moderna as soon as possible. And others, so people 60 years or over, please check with your GP or your local pharmacy and just make sure that everyone takes up the opportunity to be vaccinated. We're getting more and more supplies rolling out. Thank you.
Well, that is great news that we have seen some containment of this virus out of the Sunnybank cluster. And as we expect, we're now seeing some positive cases out of the school, but of course they're already in home quarantine. So big shout out to the 1,000 students and families that are quarantining. We know that by you doing the right thing, it keeps our community safe and it stops transmission spreading. So we ask people to keep an eye out on the website for any exposure sites. These two young students were out in the community for 1 or 2 days while still infectious. And of course, we're seeing more and more cases of New South Wales freight drivers coming into the state and leaving, and then us becoming aware that they were infectious while they were here. So although they don't count in Queensland's numbers, we will, as New South Wales provides us with the information, be putting up exposure sites on the Queensland website. So we do ask people to continually check that. The great news is, because Dr Young is very comfortable with the risk level in relation to this latest cluster, we can announce today that we will lift the restrictions on visiting hospitals, aged care, disabilities and correctional facilities immediately. So those Logan LGA areas and Brisbane City Council South Side, we will open them back up today so people can visit their loved ones. We know it was difficult over the weekend to not be able to visit, but we needed to make sure that we didn't have this virus moving around the community. So we thank everyone for their patience over the weekend and not being able to visit loved ones. I want to give a big shout out to Metro South Hospital and Health Service, particularly for the great work they did in testing over the weekend and also vaccinations. And of course, huge shout out across the state to all of our vaccination hubs to do a record number of 146,182 over 7 days is amazing. So as we said all along, as we get more supply, we will get more vaccine into arms, and that's exactly what we're doing. Week after week, we are seeing record numbers of vaccinations now in Queensland. I can report today that at Toowoomba, there'll be a new community-based vaccination hub opening at the Clifford Gardens Shopping Centre. So this will replace our small facility at the Bailey Henderson. And this is what we're seeing us moving to across the state, moving out of our small facilities in our hospitals to larger community-based facilities that we know, as more supply comes in, we can expand rapidly to take many more vaccination numbers. And we've seen that Cairns, of course, at the Brisbane Entertainment Centre with Boondall, and we'll keep seeing this, and of course our Toowoomba facility. So within a fortnight, that Toowoomba new vaccination hub will start operating 7 days a week. So that is fantastic because we know that's what the community wants. They want to be able to access any day of the week, particularly weekends, and that's what they'll have at Toowoomba. So anyone out at Toowoomba, please make sure you come out to our new vaccination site and get vaccinated as quickly as possible.
Thank you, Premier. Our new system went live last night for the border zones, particularly around the Tweed, where we know we have numbers of people wanting to come across. So that successfully went live last night. And even though we saw 4,917 vehicles processed yesterday and 96 turned around, we expect those numbers to increase. I'm pleased to say that as of 7 a.m. this morning, there was only a 9-minute delay on the M1 and less than 5-minute delays everywhere else. And most recent check tells me that those delays remain minimal. But the message is still there for people, can expect delays at times, so depending on when they cross, expect to do that. We have seen some turnarounds, and this is primarily people that are coming to work who have not had at least one vaccination. Please, under the directions that we're having in our border zone, that people need to understand that should they come across, they have to meet the requirements to be able to enter Queensland, even with the border pass. So they are required to have that if they're coming across for work purposes. Otherwise, if they're coming across, they must have an essential purpose. Please, if they're not sure about that, check with the Queensland Health website or seek advice on that through Health. Overall, yesterday we saw 173 people quarantined in our domestic hotel quarantine. 95 of those were relocating to Queensland and 41 were returning Queenslanders. Low levels of enforcement yesterday, so thank you to everyone. Only one pin for someone failing to wear a mask in a shopping centre. No arrests, and 75 businesses checked and no breaches at all for those people. And we handed out 24 masks. So overall, compliance is very good, and we thank you for that. Thank you.
Premier, are we less likely now to be going into lockdown, given you can lift those restrictions on the hospital visits?
We're a lot more comfortable. So, I think, Queenslanders, of course, especially in the southeast, very concerned about whether or not we are. As I said the other day, we would be looking to see if there was any seeding that happened outside that home quarantine. So fingers crossed, it's all looking good at the moment.
Premier, does there need to be tighter rules around frameworks? I know that there's national frameworks through, but what's your opinion?
Yeah, no, National Cabinet has delegated that to the Transport Ministers to have a look at. My understanding is that they're required to be tested every 3 days. The problem with testing every truck driver that comes into the state is we have thousands, and you can imagine then the traffic jams that we would have. But, I think we do need to have a good conversation with people about encouraging those freight drivers to get vaccinated.
What about rapid testing for truck drivers?
Look, I think they're looking at all options, but even then it's hard to work out how that would be administered. Look, I just think let's keep all options on the table, and, it is a priority that these freight drivers are going right across Australia.
There are 3 people who entered the state. Can you tell us what exemptions they had?
I think police will have that, so if there's any other questions for me, and then I'll hand over to police.
Premier, we've just heard some really heartbreaking stories on the border this morning. A Queensland man actually collapsed. He's okay. His name's Ron Fenwick. But he went to New South Wales for heart surgery, and he's been trying to get back into Queensland.
I'm not aware, Marlena, of those issues. So, look, the exemptions unit will work through those. I don't have that up-to-date information.
Could there be more resources for the exemptions unit, or maybe
We addressed that the other day. We are increasing the exemptions unit, so that is getting more resources. So that was actually asked the other day.
What about a liaison person on the border or something like that? Because a lot of people going to the border with 2 police with their problems, and they're obviously going through a lot of heartbreak about trying to get back.
Yeah, well, there's the people who work in the Department of Health can actually talk to people, so that's not an issue. They can talk to them.
In terms of quarantine, last week you said there was like 600 rooms freed up, but Steve was saying there's 173 people in domestic quarantine. How many rooms?
No, that's how many who came in yesterday.
Oh, right.
Yeah. So what the Deputy Commissioner gave you was just how many came in yesterday into Queensland.
So how many more rooms do you expect to be freed up this week?
Oh, I don't have that information. We can get that to yeah.
We know the Logan vaccination hub opened, and we're
Yep.
seeing a few things like that happening in Logan. Are you still concerned about their low vaccination rate in Logan, and do you think that'll be enough to lift it?
Look, there's more and more people getting vaccinated, which is wonderful. So I think the message is getting out there. Like I said, we've had meetings as well with the leaders of the multicultural communities, and they're working with us as well, encouraging people. I think, you know, people like the walk-in, so I think we need to look at how we can facilitate more of that to encourage people to come and get vaccinated.
And also with people, say, coming out, there's a story about a man from Childers who went to bury his son down in New South Wales. He tried to drive back over the border, but was told he had to fly back. We're hearing that a bit now. Is there a reason why people have to fly back and can't drive back over the border?
It's because of the risk, okay? So as we know, and I'm quite sure Dr Young can expand on this, there is a lot of virus in New South Wales. I mean, you only have to look at the tens of thousands, we're over 30,000 cases at the moment, and there is a lot of virus in New South Wales, and we are very concerned that that can come back into Queensland. So you've even seen, like with the freight drivers, we're picking that up. Well, New South Wales is picking up in the first instance because they're getting tested every 3 days. I think there's a lot more virus in New South Wales, but they can't cope with the testing.
Just about the voluntary design,
Yeah.
do you have a final message for MPs?
Look, it's a conscience vote for members of my government. I once again urge everyone to be respectful in their debate. It's a deeply personal issue for a lot of people, and I do know that there are a lot of people out there that support this. And can I guarantee to Queenslanders, it has been through a very thorough process. It has gone through a very big consultative process right across Queensland. Not only that, the Law Reform Commission has done an excellent job in producing that bill that we introduced into Parliament. So this week we will be debating that bill. It is, of course, groundbreaking, and once again I urge everyone to be very respectful in the debate and also in the public commentary as well.
When will we know if Cabinet has made any changes to that legislation?
When will you know? Well, we'll be debating it this week.
But when will, so MPs can have a chance to look over?
Yep, well, I've got a caucus meeting this afternoon.
So this afternoon we'll see those changes?
Well, you might not hear about it this afternoon, but you'll hear about it when I'm ready to tell you about it.
Just on the under-12, saying you obviously raised concerns recently about
Yes, I did.
vaccinations,
Yes.
and there are some reports about rolling out
Yes.
COVID jabs for primary schools.
Yes, yeah.
Do you know about that?
Well, what I say is that it's good to see that the Federal Health Minister has finally caught up on the international research and the trials that are being conducted. This is exactly what I raised a few weeks ago. This was why I was attacked. And I think it's good to see now that the Federal Health Minister has caught up with that international research.
So just to clarify, kids 12 to 15-year-olds at Queensland Health Hubs today, is it still for that priority group?
Sorry?
Is it all 12 to 15-year-olds? Because there's a bit of confusion with parents. You can go to a Queensland Health Hub and book in.
Yeah, you can book in, yep, 12 to 15, and they can go to their GPs as well and pharmacies as well.
Anyone 12 to 15,
Yep.
not just priority.
Yep, yep. Okay, and I think you want to talk to the Deputy Commissioner? Yep, thank you.
Yes, Commissioner, you did clear up the circumstances of those 3 people who crossed over the border.
What I can tell you is that we are investigating the circumstances of that. That's going to take some little time to do that because we need to access other documentation. And of course, some of those people have returned to New South Wales, which is currently, at least in part, in lockdown. So we will have to work through that, and it's going to take us a little while to get that. So hopefully in the next couple of days, we'll get some clarity around it.
Is there a situation where they had exemption passes to come in?
So we'll pull all the passes that they did have. So for people coming through, there are either exemptions that they need to have before they can get a pass, or there are indeed conditions for entry on the pass if you're a border zone person. So we're working through all that to make sure that we've got all the material that's in our system. No, look, as we always do when we investigate things, we don't play that out in public and in the media about what we're doing. We will conduct a thorough investigation and then we'll advise the outcome in due course.
Down on the border, there seems to be a lot of confusion today with people getting turned around. Is it the police experiencing a bit of frustration down there?
Yeah, Tim, I mentioned that we've had some turnaround where they've turned up thinking they go to work and they haven't met the requirements around crossing, having had at least one jab, so one vaccination shot. People really need to check the system when they get in there. The system actually explains to them what they're required to do. So when they engage with online applications for their border passes, when they have to understand why they're coming through, it's not a complete free travel bubble. We've gone to a position where you have to have an essential purpose, or you can come in for work purposes if you can't reasonably do that work from home. And then there's the additional requirement for vaccination. People really need to understand that. We've been very clear about that's what's required up front before they get to the border. If you don't have the right paperwork and the right passes, our officers will turn you around. Thank you.
Are you still expecting to see cases outside of people in home quarantine? Or, I mean, it sounds like you're pretty relieved that it's in control.
I am very relieved, but yes, there is a real risk that we will have cases out in our community because we are seeing, we're up to 9 now, truck drivers who've come across the border and been in Queensland while infectious. So yes, these cases could happen anywhere. So that's why it doesn't matter where you are in Queensland, if you've got any symptoms at all, please immediately go and get tested, as enormous numbers of Queenslanders are. And also, could people please check our website for exposure venues. So if you've been to any of those exposure venues, we need you to get tested as well.
Those two students, how old are they? How are they actually doing? The two students who just positive today.
Yep, they're reasonably well. They're being looked after by their parents at home.
And how old are they?
They're 15 going on 16.
Are they in the same house? Are they in the same house?
No, 2 separate households.
So, male or female?
One's a male, one's a female.
Dr. Yanko, around essential workers, are they allowed to come into Queensland, do their essential work, and then do they have to go back home? Or are they able to, is there any monitoring on what they do once they get into the state?
No, we trust them that they come in, that they do whatever they need to do as part of their work, and that they return home. And that's both ways. So that's a Queenslander going down into the allowed area in New South Wales, remembering not the entire border zone. There's still some parts of that border area that New South Wales has in lockdown, so that's not part of this. This is the part of New South Wales border zone that's not in lockdown. So Queenslanders who can't reasonably work from home can travel down there if they've had 1 dose of vaccine. They need to go down and then come back, and vice versa. If you're working, yes.
Do you see that extending when the border eventually reopens, that anybody coming to Queensland from other states will be required to have at least 1 dose of the vaccine?
No, but we've got targets to reach, 70 and then 80%, and that is what will protect people. But at this point in time, while we don't have those targets in place yet, we don't have those numbers of people vaccinated. That's why I'm asking that people coming into workplaces, which are a risk, need to have had at least 1 dose, and then as soon as possible, I expect them to get their 2nd dose.
So Dr. Young, in relation to the specific essential workers who have come across the border, is there any circumstances where an essential worker should have stayed in the household of the man who's then tested positive, the father? Are there any circumstances where that situation...
That's a lot of hypotheticals. I think I'd like police to do that full investigation and work out what happened.
Quickly, South Australia is committed to reopening the borders at 80%. Are you any closer to a decision about what you...
We're all working towards the national plan, and the national plan is to get 80% of the entire Australian population vaccinated, and that's exactly what we're working towards.
Will your daily briefings continue, Premier, in New South Wales? That stopped, that sort of started again today. Can Queenslanders expect to see you doing briefings every day?
Well, I won't necessarily be here every day, but the government will be here every day. How's that sound? I think we've got to let people know what's going on. So that's been my philosophy. If I'm not here, the health minister's here or the deputy premier's here, but we will be updating Queenslanders.
There's been talk in Western Australia about forcing remote Indigenous communities as low vaccination rates to close. Do you hear the same thing on that?
Sorry, to
close?
look, we're working with all of our communities, especially across the Cape, and we are making endeavours to make sure that the vaccination levels are being lifted there as well. Yeah. Yep. Okay, thanks.
And we're not even in a situation where we should.
Are you addicted to it?
No.